Hello and Assalamualaikum. We will be presenting our case study 2 presentation starting from topic 1 until topic 8. Our lecturer name is Puan MUMTAZ binti SAHADAN. So now I, as a representative of the group, will now presenting our group members. The first one will be NATASYA QISTINA binti HALPIAN. Her metric number is 08DU23F1106. Next is NURIFFAH ZUHAIRAH binti ZINATUL HAZRI. Her metric number is 08DU23F1052. And lastly would be me. My name is Puteri Nurfahani Nadhira binti NAWAWI. And my metric number is 08DU23F1064.
Hi, in this slide, I will explain about topic 3, which is nervous system. Resting potential. When an A plus channel and K plus channel are closed, the outside of the plasma membrane is positively charged compared to the inside. Next, depolarization happens when the Na plus channel and K plus channel open. This is because the inward movement of Na plus make the inside of the membrane more positive. Next, the repolarization happens when Na plus channel close while the K plus channel open. Then, Na plus movement into the cell stop while the K plus movement out of the cell increase, which lead to the repolarization. So in this slide, I will explain about how an action potential is generated. In a neuron with a resting membrane potential of negative 70 MV, reaching a threshold of around negative 55 MV trigger the opening of sodium channel. Positively charged sodium ion enter the cell, causing a rapid depolarization as the membrane potential rise and becoming positive. This is the rising phase of the action potential, which then travel down the neuron. Next, as the action potential peaks, sodium channel close while the potassium channel open. This allowing potassium to exit the cell, then promote repolarization that known as falling phase. As the neuron returns to its resting membrane potential. However, it briefly hyperpolarizes during the refractory period, making it harder to trigger another action potential. Eventually, potassium channel close and the membrane stabilizes back to resting potential. The action potential travels down the neuron and potentially release neuron transmitter at the axon terminal to transmit the signal to the next neuron. The common disorder, disease, and injury related to the nervous system. The first one is Parkinson's disease. It's a degenerative disorder of the central nervous system. System symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with walking. Next, epilepsy. Epilepsy is a brain disorder in which cluster of nerve cell or neuron. In epilepsy, the normal pattern of neuronal activity become disturbed, causing strange sensation and emotion. Next, meningitis. Meningitis is inflammation of the protective membrane covering the brain and spinal cord. The inflammation may be caused by infection with virus, bacteria, or other microorganisms. Related diagnostic technology or equipment. The first one is electroencephalography or EEG, and electroencephalogram is a test that measures and records the electrical activity of your brain. Special sensors are attached to your head and hooked by wire to a computer. Next, computed tomography or CT scan is a X-ray based technology that produces cross-sectional image of the brain, helpful for identify injury, bleeding or tumor. Magnetic resonance imaging or MRI use strong magnetic field and radio wave to create detailed image of the brain and spinal cord. MRI can detect structure abnormality, tumor, and signs of multiple sclerosis. Hi, in this slide, I will explain about topic 3.1, which is endocrine system. Function of endocrine system. The first one is hypothalamus, connect the nervous system and endocrine system, control hormone from the central nervous system. Pineal gland, produce melatonin that regulates sleep. Pituitary gland, monitor and regulate growth hormone. Next, control reproductive glands. Thyroid, regulate metabolism and use of energy. Produce hormone like thyroxine and tridotropin. Adrenal gland, produce hormone that help regulate metabolism and other body function. Control the fight and flight response to the stress. Pancreas, produce hormone that regulate blood glucose. Produce insulin and glucagon. Ovary in female, produce estrogen that control female puberty, and progesterone that manage fertility. Testes in male, produce testosterone that control male puberty and ability to produce sperm. Okay, now I will explain about the common disorder, disease, and injury related to the endocrine system. So, the first one is type 1 diabetes. What is type 1 diabetes? Okay, the type 1 diabetes is an autoimmune disease where the body immune system attack the insulin producing cell in the pancreas. Next, type 2 diabetes is a condition characterized by insulin resistance where the body cell don't respond effectively to the insulin. Hypothyroidism is a condition characterized by abnormally low thyroid hormone production. In hypothyroidism, the thyroid gland can be small or large depending on the cause of low level of thyroid hormone. Next, polycystic ovary syndrome or PCOS is a hormonal disorder that affects women of reproductive age. It is characterized by irregular period, excess estrogen level, which is male hormone, and the presence of small cysts on the ovary.
Assalamualaikum and hi. Next, I will present about chapter 3, which is blood. There are three types of blood cells in our body. The first one is red blood cell, RBC, which is known as erythrocyte. RBC characteristic is most abundant cell in the blood. It also have a biconcave shape, which is round and flat. There are no nucleus in the RBC. RBC also can change shape without breaking. It also contains a protein chemical known as hemoglobin. RBC is the function of RBC is transport oxygen from the lung to the cell of the body. It also pick up carbon dioxide, which is CO2, from other tissue and unload it in the lungs. It also carry part of the CO2 waste from the cell. The next blood cell is white blood cell, WBC, which is known as leukocyte. The WBC have only about 1% of the blood. They are the cells that make up the majority of the immune system and also responsibility for the defense system in the body. The defense body is to fight infection and protect our body from bacteria. There are 5 types of WBC. The first one is neutrophils, known as granulocyte. Neutrophil is most common type of WBC, and it also have a medium-sized white blood cells. It also make up about 55% to 70%. Neutrophils, the function of neutrophils is to kill bacteria through the process of phagocytosis, and also release a burst of superoxides that have the ability to kill many bacteria at the same time. This is how neutrophils looks like. The nucleus is said to be in the C shape. The second one is eosinophils, also known as granulocyte. It has a large granules and make up about 2% to 5% of the total of blood count. The function is to mainly attack parasites and any antigen complexes. It also runs possible for allergic response within the blood. The third one is basophils, which is make up less than 1% of the total white blood count. It also colorful when stained and looked at under microscope. The function is they secrete anticoagulant and antibodies that have function against hypersensitivity reaction in the bloodstream. It also known to have phagocytory feature, immediate immune reaction against external germs and disease. Next is monocyte. Monocyte have only 5% to 8% in the total white blood count. It is the largest of the five types of WBC. Monocytes also have a kidney-shaped nucleus present. When enter the tissue, they become larger and turn into macrophages, and it also removes foreign particles and prevent the invasion of germs. Last but not least is lymphocyte. Lymphocyte is a small round cells which produce antibodies against toxins secreted by bacteria and infecting germs. These antibodies will secrete into the plasma to kill bacteria in the blood. They also function in destroying cancer cells. The last one in blood cell is platelets, also known as thrombocyte. It do not have a nucleus and also do not reproduce. It also a small fragment of bone marrow cells, the parts of cells that the body uses for clothing. The function is to promote other blood clotting mechanism. Blood clotting is a body mechanism to stop or minimize blood loss from damaged blood vessels. And it also activates some proteins in the form of fiber as a network. This network traps the escaping RBC and form a clot that will seal the cut blood cells and so bleeding is stopped. Related diagnosis technology or equipment. The first one is complete blood count, CBC. CBC is an analysis of the blood that provide much more information. There are four types of CBC. The first one is red blood count, RBC, also done electronically with a machine. RBC for the male is 4.6 to 6.2 million per microliter, and for the female is 4.2 to 5.4 million per microliter of blood. The second one is hemoglobin measurement. It is to determine the amount of hemoglobin in a given volume of blood. The second one is hematocrit measurement, which is the percentage of total blood volume composed of RBC is the hematocrit. The last one is white blood count, WBC, to measure the total number of WBCs in the blood. It also normally about 5,000 to 9,000 WBC per microliter of blood. The second one is laboratory equipment. There are three equipment that was used. The first one is hematology analyzer. It is to use to perform complete blood counts, erythrocyte, sedimentation rates, ESRs, or coagulation tests. The second one is centrifuge. It is a piece of equipment driven by an electric motor that puts an object in rotation around a fixed axis. The last one is blood gas analyzer. It is a measurement of how much oxygen and CO2 is in your blood. Also determine the acidity of your blood. In this slide, I will explain about chapter 4.2, which is cardiovascular system. In this slide, I will explain how blood will flow through the heart. First of all, our heart have four chambers, which is left atrium, left ventricle, and right ventricle. The right hand side of the heart, where deoxygenated blood from all over your body enter right atrium through two large veins, which is your superior vena cava and inferior vena cava. This vein drain blood from your upper body and lower body and directly empty it into your right atrium. Your tricuspid valve open to let blood travel from your right atrium to your right ventricle. When your right ventricle is full, it squeezes, which close your tricuspid valve and open your pulmonary valve. Blood flow through your main pulmonary artery and it branch to your lungs where it get oxygen and release carbon dioxide. Where the left hand side of the heart, which is oxygenated blood travel from your lungs to your left atrium through large veins called pulmonary veins. This vein directly empty the blood into your left atrium. Your mitral valve open to send blood from your left atrium to your left ventricle. When your left ventricle is full, it squeezes, which close your mitral valve and open your aortic valve. Your heart sends blood through your aortic valve to your aorta, where it flows to the rest of body. In these slides, I will explain about cardiovascular disorder. The first one is coronary artery disease, CAD, which is a blockage of coronary arteries which supply oxygen-rich blood to heart. This blockage can lead to a reduction in blood flow to the myocardium. The second is congestive heart failure, a long-term condition in which heart can pump well enough to meet your body's needs. There are three types of congestive heart failure, which is left side, right side, and high output, which is a rare type of heart failure. The cause of this congestive heart failure is genetic, heart attack, congenital heart disease. The last one is arrhythmias, a disorder of the heart rate or abnormal rhythm in the electrical heart conduction system. The heartbeat is either too fast, which is tachycardia, or too slow, bradycardia. There are several types of arrhythmias, which is the first one is atrial flutter, which is rhythm average between 240 and 316 beats per minute. The second is tachycardia, which is heart rate in excess of 100 bpm. And the last one is bradycardia, which is heart rate less than 60 bpm. Then, this is related diagnosis technologies or equipment that was used. The first one is electrocardiogram, which is ECG. ECG is a measures the electrical activity of the heart to identify arrhythmias or heart attack. It consists of P wave, which is depolarization of the atria and atrial contraction, and QRS complex, which is depolarization of the ventricle, and lastly is T wave, which is repolarization of ventricles. The second one is CT coronary angiogram, which is an advanced imaging technique to visualize coronary arteries and detect blockage or plaques. Lastly is artificial pacemaker, a small device implanted in the body to help regulate abnormal heart rhythm. It generates electrical impulse to stimulate the heart and maintain normal heart rate. In this slide, I will explain about chapter 5, which is respiratory system. The mechanism of inhalation and exhalation of respiration. For the inhalation part, we inhale oxygen into the lungs, and the diaphragm becomes flattens. For the intercostal muscle, it becomes relaxation of internal intercostal muscle and contraction external intercostal muscle. For the exhalation part, we expel air out of the lungs, and the diaphragm becomes relaxer and also have a dome shape. For the intercostal muscle, contraction of internal intercostal muscle and also relaxation external intercostal muscles. There are many common disorder and disease of respiratory system, but in this slide, I will explain about three disease and disorder. The first one is asthma. Asthma is a chronic inflammatory disease that causes breathing problem when the airway blocked by mucus. The symptoms are wheezing, coughing, and shortness of breath. The second is pneumonia, which is an infection that inflames the air sacs in one or both lungs. The symptoms are fever, chest pain when you cough, or breathe and nauseous. The last is lung cancer, which is uncontrolled growth of abnormal cells in the lungs. The symptom of lung cancer is chest pain, chronic cough, difficulty breathing, and wheezing. Lastly is related diagnosis technologies or equipment that was used. There are many equipment that was used, but in this slide I will explain only about three. The first one is chest X-ray, which is a common imaging test that use X-ray to create image of the lung and chest. Next is CT scan, which is more detailed imaging test that produce cross-sectional image of the lung. Lastly is bronchoscopy, a procedure that involves inserting a thin tube with a light and camera into the airways to examine the lungs.
So now I will presenting chapter 6, which is digestive system. So what is digestive system in general? The digestive system is a complex series of organs and glands that work together to break down food into nutrients that the body can absorb. It's like a long muscular tube that starts at the mouth and ends at the anus. So now I will tell you about the process starting from the mouth until the anus. The first one would be when food enters the mouth where it is chewed and mixed with saliva. Next is food travels down the esophagus to the stomach. Furthermore, in the stomach, food is further broken down by acid and enzymes. So right after that, partially digested food, which is also called as chyme, moves to the small intestine. Various nutrients are absorbed in the small intestine. Next, where undigested material moves to the large intestine, where water is absorbed. So last but not least is waste is stored in the rectum and eliminated through the anus. So now is the chemical digestion along the gastrointestinal tract. Chemical digestion involves the breakdown of food molecules by enzymes. Enzymes are proteins that speed up chemical reactions. The digestive system produces a variety of enzymes that break down carbohydrates, proteins, and fats. The first one would be carbohydrates. So, carbohydrates are broken down into simple sugars by enzymes such as amylase and maltase. Next is protein. Proteins are broken down into amino acids by enzymes such as pepsin and trypsin. Last but not least is fats. Fats are broken down into fatty acids and glycerol by enzymes such as lipase. So these are some related diagnosis technologies or equipment that can be used to detect the signs of disease. So the first one is endoscopy. Endoscopy is a procedure that allows doctors to view the inside of the digestive tract. A long, flexible tube with a light and camera at the end is inserted into the body through the mouth or anus. Next is colonoscopy. Colonoscopy is a type of endoscopy that allows doctors to view the inside of the colon and rectum. The third one is barium X-ray. A barium X-ray is a type of imaging test that uses a contrast material called barium to visualize the digestive tract. Last but not least is the blood test. Blood tests can be used to measure levels of enzymes and other substances that may indicate problems with the digestive system. Now we'll be going on to chapter 7, which is urinary system. So this is the process of filtration in urine formation. So the filtration that happens in the urine formation is glomerular filtration, which is water and solids smaller than proteins are forced through the capillary walls and pores of the glomerular capsule into the renal tubule. So the filtration in urine formation has several processes which started from the filtration site. It is occur at the glomerulus, specifically between the glomerular capillaries and Bowman's capsule. Next is blood supply. Afferent arterioles bring blood into the glomerulus, carrying both useful substances such as glucose, amino acids, vitamins, etc., and waste products, which is urea, uric acid, creatinine, etc. Furthermore, pressure gradient. So afferent arterioles are narrower than afferent arterioles, creating a high hydrostatic pressure in the glomerulus. This pressure forces fluid and solutes out of the blood and into Bowman's capsule. Next is opposing forces. Blood colloid osmotic pressure, pressure exerted by proteins in the blood opposing filtration, while capsular hydrostatic pressure is pressure exerted by fluid in Bowman's capsule opposing filtration. So moving on is the net filtration pressure, NFP. NFP is the difference between the forces favoring filtration and those opposing it. A typical NFP of 10 millimeter hemoglobin drives the filtration process. In addition, glomerular, glomerular filtration rate, GFR, is when the volumes of filtrate formed per minute by both kidneys. A healthy adult GFR is approximately 125 millimeter per minute, resulting in the production of 180 liters of filtrate daily. Last but not least is filtrate composition. The filtrate contains water, small solutes, which is glucose, amino acids, ions, urea, uric acid, and etc., but lacks blood cells and large proteins. So finally, these are the related diagnosis technologies or equipment which can detect the disease that happen in the urinary system. So the first one is ultrasound. Ultrasound is a non-invasive imaging test that uses sound wave to create images of the organs and tissues inside the body. Ultrasound can be used to visualize the kidneys, bladder, and ureters. Next is CT scan. A CT scan is an imaging test that uses X-rays to create cross-sectional images of the body. CT scan can be used to diagnose kidney stones, tumors, and other abnormalities of the urinary system. Moving on is the MRI. An MRI is an imaging test that uses a magnetic field and radio wave to create detailed images of the organs and tissues inside the body. MRI can be used to diagnose kidney tumors, cysts, and other abnormalities. Last but not least is blood test. Blood test can be used to measure levels of creatine, creatinine, urea, and other substances that may indicate problems with the kidneys.
Hi, in this slide, I will explain about topic 8, which is reproductive system. Hormone and their function that influence the male and female reproductive system. So for male, the hormone is testosterone produced by the testes. It is responsible for the development of male secondary sexual characteristics such as increased muscle and deeper voice. Testosterone also play a crucial role in sperm production. Next, follicle stimulating hormone of or FSH produced by the pituitary gland. FSH stimulate the testes to produce sperm. It acts on the Sertoli cell in the testes, which support and nourish developing sperm cell. And the last one is luteinizing hormone or LH, produced by the pituitary gland. LH stimulate the production of testosterone by acting on the Leydig cell in the testes. This boosts in testosterone is important for sperm production and the development of male sexual characteristics. Okay, next for the hormone female. The first one is estrogen, produced by the ovary. Estrogen is responsible for the development of female secondary sexual characteristics such as breast development and wider hips. It regulates the menstrual cycle by thickens the endometrium in preparation for a possible pregnancy. Next, for progesterone, produced by the ovary, progesterone prepares the uterus for pregnancy by maintaining and thicken the endometrial lining. If pregnancy occurs, it helps sustain the pregnancy by supporting the uterine lining and preventing uterine contraction. And the third one is follicle stimulating hormone or FSH, produced by the pituitary gland. FSH stimulates the growth and maturation of ovarian follicle in the ovary. The another hormone of female is luteinizing hormone or LH, produced by the pituitary gland. LH trigger ovulation, which is the release of mature egg from the ovary. After ovulation, LH stimulates the formation of the corpus luteum, which produce progesterone to support a potential pregnancy. Next, and the last one is human chorionic gonadotropin or HCG, produced by the placenta after the embryo attached to the uterine lining. The function is maintain the corpus luteum during the early stage of pregnancy, allowing it to continue producing progesterone until the placenta can take over the hormone production. The role of placenta during pregnancy. The first one is as nutrient and oxygen supply. The placenta transport essential nutrient and oxygen from the mother blood to the fetus through the umbilical cord. This supply is important for the healthy fetal growth. Next, waste elimination. It also removes waste products like carbon dioxide and other metabolic byproducts for the fetus by sending them back to the mother blood to be expelled from her body. And the last one is has as hormone production. The placenta produces hormone including human chorionic gonadotropin, estrogen, and progesterone. This hormone helps sustain the pregnancy and prepare the mother body for the labor and delivery. Related diagnosis technology or equipment. The first one is Pap smear. It's a screening procedure used to detect early signs of cervical cancer. It involves collecting cells from the cervix, which is the lower part of the uterus that opens into the vagina. These cells are then examined under a microscope for any abnormality. Next, pelvic ultrasound. This imaging technique uses sound waves to visualize the internal organs of the pelvis, including the uterus, ovary, and fetus during the pregnancy. And the last one is hormone test. Blood tests can measure level of various hormones such as FSH, LH, estrogen, progesterone, and testosterone to assess reproductive function and fertility.